Hi, this is Galit Gopar. Thank you very much for joining me here today. Today I'm going to be talking about treating hemorrhoids with diet, supplements, and natural therapies. Hemorrhoids are a widespread condition with a general population prevalence ranging between 13 and 36%. And for people between the ages of 45 to 65, the incidence rises to about 50% of the population. Although rarely dangerous and they rarely cause severe complications that demand medical attention and surgery, hemorrhoids can be very uncomfortable and may be extremely painful, especially during bowel movements. There's often also itching, burning, and painful swelling and bleeding. Hemorrhoids develop when the supporting tissue of the anal hemorrhoidal veins, they disintegrate or deteriorate, and then there is a rupture. This leads to a severe inflammatory reaction involving the vascular wall and its surrounding connective tissue in the anus. Now, hemorrhoids are also caused by hormonal changes before or during menstruation, and hormonal changes and increased intra-abdominal pressure that happens during pregnancy. It is estimated that between 25 and 35 people, pregnant women are affected by hemorrhoids. And in specific populations, this number rises up to 85% of all pregnancies when the women are affected by hemorrhoids in their third trimester. Now, hemorrhoids can be recognized by bright red spotting on toilet paper or blood in the toilet bowl. Also, soiling of the underpants may occur in advanced stage hemorrhoids. This is due to impaired ability to control the bowel movements and production of mucus discharge from the anus. Now, this discharge causes itching and irritation, and these unpleasant and disruptive symptoms may keep you from having a better quality of life. But fortunately, the condition is manageable and treatable through natural methods, including dietary changes, supplements, and natural therapies. So here are 9 natural ways to treat hemorrhoids. Number 1, you want to increase your fiber intake. Increasing fiber intake helps soften bowel movements. It helps relieve constipation and reduces the straining that happens during bowel excretion when there is constipation. A high fiber diet rich in whole grains, fruits, and raw vegetables is the best way to manage and heal hemorrhoids. Further to increasing fiber intake in the diet regularly, also treatment with fiber supplements is recommended, at least in the initial stages. A study following 102 patients with advanced hemorrhoids concluded that fiber supplementation could help stop the condition's progression and eliminate the bleeding episodes. Fiber supplementation also helps most people with advanced hemorrhoids to avoid surgery. Now, since fiber supplements are safe and very cheap, they remain an integral part of treatment. Now, the recommended intake of fiber supplementation is about 5 to 6 teaspoons of psyllium mixed with about 600 milliliters, like 2 cups, 2 or 2.5 cups of water. These fiber supplements can relieve symptoms of non-prolapsing hemorrhoids that are within the anal canal. But some researchers also suggest that it may take up to 6 weeks to see significant improvement. Therefore, I recommend persisting with fiber supplementation until you see a healing, after which I recommend stopping the supplementation. You don't want to become, your body doesn't want to need these fiber supplementations to go to the toilet on a regular basis. So you do want to stop the supplementation and just adhere to a high fiber plant-based diet to prevent recurrence of the disease. Also, you want to increase your antioxidant intake. There is involvement of free radicals in hemorrhoids. It is known that antioxidants neutralize free radicals. The antioxidants that are proven to have the most therapeutic effect for managing hemorrhoids are flavones, and these flavones are contained in citrus fruit peels. In a review of 14 trials, the literature shows that these flavones reduce the severity of bleeding and prevent hemorrhoid relapse. These results and the literature analysis agree that flavonoids have better performance than traditional treatment and are an effective treatment in terms of shorter time of disappearance of bleeding and anal irritation in patients with all grades of hemorrhoids. Now, bleeding and irritation heal by the first week when the people consume flavonoids in supplement form. Also, you want to use witch hazel as a topical treatment. Witch hazel has been used directly on hemorrhoids to help reduce the pain and prevent the itching. The herbal extract is known as an anti-inflammatory and contains tannins and oils that can help slow down bleeding and reduce inflammation. Also, you want to reduce the amount of spices you consume in food. Frequent spice intake was more frequently found in people suffering from hemorrhoids than in the controls of certain studies. Also, you want to use a sitz bath. A sitz bath is a warm, shallow bath that cleanses the buttocks, the bottom. To be an effective treatment method for symptoms of hemorrhoids, the water should be approximately 38 to 40 degrees Celsius, which is about 100 degrees Fahrenheit, and you should limit the soak time to no more than 15 minutes. The right temperature cleanses the perineum and helps increase blood flow, minimizing itching, irritation, and minor pain. To prevent irritation and inflammation, the sitz bath should not contain any oils, lotions, or any salts at all. You also want to increase your water intake. The leading causes of hemorrhoids involve bowel movements and behaviors, particularly straining, sitting on the toilet for long periods, and having chronic constipation. All of these can be solved by drinking more water. Therefore, drinking sufficient water is crucial as a dietary modification for hemorrhoids. It helps soften the stools and prevents excessive straining. It also helps prevent constipation by stimulating bowel movements. The recommendation is to drink sufficient water. You can calculate your water needs by visiting the video found in the description below that I talked about how much water you need according to your weight. Now, you also want to stop smoking cigarettes. Cigarette smokers are more prone to experience constipation and dry stools, both of which aggravate hemorrhoids in most people. Also, you want to follow better toileting behaviors. Dysfunctional bathroom habits such as excessive straining and pushing have been associated with hemorrhoids. You should limit the time you spend on the toilet to no more than 5 minutes. Best 3 to 5 minutes is best. You should avoid reading on the toilet as well. Listen to your body and go to the bathroom when you have an urge. Holding it in and waiting too long can also lead to constipation, which will cause you to push harder and strain when you finally do reach the toilet. You should also avoid excessive wiping because it can injure the delicate skin of the anus and cause anal tears, while the stool left behind can aggravate enlarged hemorrhoids. Excessive wiping and cleaning, particularly with perfumed alcohol-based wipes or liquid soaps, can cause allergic reactions and worsen the condition. Therefore, I recommend washing with soap and water. It's the best practice after you go to the bathroom. Now, also, your posture when you're in the bathroom is very important. Squatting, the posture for defecation has been changed in the past 100 years after Western industrialization, and the use of a pedestal toilet in sitting position is not a natural posture for defecation. Squatting is the natural way to go to the bathroom, making elimination faster, easier, and more complete, and securely seals the valve between the colon and the small intestine when you're on the toilet. Squatting also reduces the pressure required for defecation. So I recommend putting a stool in the toilet, putting your legs on top of it, and then using the bathroom, and it puts you in a squatting position, and it's really great. So to summarize, the lifestyle modifications mentioned here should be advised to anybody with hemorrhoids as preventative measures and as a treatment method. These changes include increasing dietary fiber intake in your diet. You may also add fiber supplements in the beginning stages. Also, you want to add fluids and drink sufficiently. You want to also regularly exercise to improve your muscle fitness. Also, you want to improve your anal hygiene and abstain from straining and reading on the toilet, as well as abstain from smoking. It is also important to note that hemorrhoidal symptoms are prevalent, but may also mask colorectal cancers and inflammatory disease symptoms. So you do want to be careful and make sure that you do have hemorrhoids and that it's not a symptom of something else more serious. So thank you very much for joining me. I hope you found this video helpful. If you did, please give it a thumbs up. Please also visit my website, thegorilladiet.com, if anything help you with your weight issues, your health issues. You have lots of information there and lots of programs on weight loss to really help you make the most of your health. So I hope you like this video. Thank you very much for joining. See you in the next video.